All right, here we go, 3:30. Thurston County Board of Health meeting for Tuesday, January 14th, 2020. We'll start with introductions. And my name is Ty Menser. I am the 2020 Chair of the Board of Health. To my left,
Gary Edwards.
to my right,
John Hutchings.
we have the Clerk of the Board, Lydia Hodgkinson. We have our Public Health Director and the Administrative Director for the Board of Health, Shelley Slaughter, and our County Manager to her right, Ramiro Chavez. So we've called the meeting to order. We need an approval of today's agenda.
I move that we approve today's agenda.
Second.
All in favor?
Aye.
Aye.
Aye. We have an agenda. We have meeting minutes from December 10th, 2019. Do I have a motion regarding those minutes?
Mr. Chair, I move to approve the meeting minutes from December 10, 2019.
Second.
Any discussion?
Nope.
No, sir.
All in favor?
Aye.
Aye.
Aye. Okay, meeting minutes approved from December 10th. That moves us directly to item 2 on today's agenda, which is presentations, proclamations. There are 3 items. The first is 2020 election of officers for the Board of Health. Turning to Ms. Slaughter.
Good afternoon, Commissioners. This requested action is to ratify the decision that you made at your December 10th, 2019 Board of County Commissioners meeting designating officers and chairs for the year. And at that meeting, Commissioner Menser was elected as chair of the Board of Health, and Commissioner Hutchings accepted the honor of being vice chair of the Board of Health this year. So we're requesting that you move to confirm these appointments for the 2020 year for the Board of Health.
Any questions for Shelley?
Nope.
No, ma'am.
Do I have a motion on this item?
Mr. Chair, I move to confirm Commissioner Menser as chair and Commissioner Hutchings as vice chair for the 2020 Board of Health.
Second.
It's been moved and seconded. Any further discussion?
No, sir.
Nope.
All in favor?
Aye.
Aye. Okay, great. We can move forward then on to page 2. Second item under this category is appointment of Board of Health Administrative Officer.
So thank you. This item is to appoint the Board of Health Administrative Officer as myself, Shelley Slaughter, Director of Thurston County Public Health and Social Services. This is an action that you initially took in 2017, and today I am requesting that you appoint me as Administrative Officer for the Thurston County Board of Health according to RCW 7005040, and asking that this appointment shall remain in effect until revoked by the board. This will prevent an annual action at the January meeting in order to make this motion. And part of this responsibility is not only administrative officer for the Board of Health in support of you, but also supervising the health officer when we have hired a new health officer, except for duties as enumerated in RCW 7005070. And I'll entertain any questions that you may have about this action.
Questions for Shelley about this?
I do not.
I don't either, and I'm not reading this particular motion.
Lucky man.
Okay, do we have a motion on this item?
I move to appoint Shelley Slaughter, the Director of the Thurston County Public Health and Social Services Department, as the Administrative Officer for the Thurston County Board of Health pursuant to RCW 70.05.040. This appointment shall stay in effect until revoked by the board. As the Administrative Officer, Ms. Slaughter shall administer the operations of the Board of Health, except for duties assigned to the health officer as enumerated in RCW 70.05.070. In addition, Ms. Slaughter will supervise and direct the local health officer in the performance of her duties. Ms. Slaughter, however, will have no authority to hire or remove the health officer.
Second.
It's been moved and seconded. Any further discussion on this item?
Nope.
Sir.
All in favor, say aye.
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 Thank you.
All right. Our third item under subset 2 is a proclamation regarding January as Blood Donor Month.
So, very honored to ask you to proclaim January as Blood Donor Month. This is a very important month to people in Thurston County who are in great need of blood products to save their lives. This proclamation highlights the life-saving contribution of blood and platelet donors and has been observed in January since 1970 with the goal of increasing blood and platelet donations during winter, which is one of the most difficult times of the year to collect enough blood products to meet patient needs. During the winter months, inclement weather and illnesses, and unfortunately, lots of motor vehicle accidents and other incidents create a high demand for blood products. And so we ask that people recognize this month and encourage donating blood. And with us today, I'm very happy to present some special guests that we have from BloodWorks Northwest. And I would like to ask Jennifer McCoy, who is the donor recruiter representative from BloodWorks Northwest, along with her staff, James Moore and Brandy Green, to come and join us at the podium to share more about the great works that you do. So thank you very much for being here.
Good afternoon. Thank you.
Hi, Jenny isn't available to be here today, but do thank you for inviting us. My name is James Moore. I supervise the Olympia teams for BloodWorks Northwest, and this is Brandy Green. She's our area volunteer manager. And it is with great gratitude that we join you in recognizing National Blood Donor Month. As stated, January was chosen as National Blood Donor Month because it's typically one of the most difficult times of the year to maintain our blood inventory. And this year is certainly no exception. We're currently experiencing a critical shortage of multiple blood types, and unfortunately this is an all too common occurrence. And we're anticipating having to cancel some blood drives due to the inclement weather, and that will certainly exacerbate the situation. So without the support of our community and local government, we could not meet the daily need of supplying local hospitals. And I'm always amazed at the response of the community when we call on behalf of our local patients. We depend on the altruism of so many different parties, whether it's blood donors, volunteers, or financial contributors. BloodWorks has provided blood and blood components to patients in Western Washington for 75 years. Our mission is to save lives through research, innovation, education, and excellence in blood, medical, and laboratory services in partnership with our community. Locally, we provide blood products to Capital Medical Center in Providence, St. Peter's. Beyond Olympia, we provide blood products to more than 90 Northwest hospitals. Our center in Olympia operates 6 days a week. We have 2 mobile units that go out into the community daily, set up at local businesses. You've probably seen our big old bloodmobile driving around. So thank you. For those that are current donors, I thank you. For those that are not, I encourage you to make a New Year's resolution to donate blood every 8 weeks. With the ice on the road, there are undoubtedly right now patients in hospitals that are in need of life-saving blood transfusions. So once again, thank you for your support. And it's an honor to have our shared mission recognized by the board. Thank you.
Thank you, James. Any
Very nice.
questions or comments for our guests?
Hope I don't need your services. Thank you.
Yes.
Thank you on behalf of those that do.
Thank you.
I would say that whether you're afraid of needles or not, it's pretty doggone easy to do. And boy, you feel good. At least I do. I feel good afterwards. And it wasn't until I was reading the proclamation that I learned a lot of this stuff. I didn't know it makes important stuff. So listen, you ready?
Proclamation.
Whereas on December 31st, 1969, President Richard Nixon proclaimed January as National Blood Donor Month and praised the generosity of the American people, declaring, "No manifestation of this generosity of spirit is more expressive and no gift more priceless in time of personal crisis than the donation of one's blood. The voluntary blood donor truly gives life itself." And whereas even with an average of 6.8 million blood donors giving the gift of blood each year, blood donations are always needed. And whereas with winter being one of the most difficult times of year to collect enough blood products to meet patient needs, as a result of canceled blood drives due to inclement weather, as well as seasonal illnesses causing some donors to become temporarily unable to donate. And whereas every day in the United States, approximately 39,000 units of blood are required in hospitals and emergency treatment facilities for patients with cancer and other diseases, as well as for organ transplant recipients, and to help save the lives of accident victims. And whereas every 3 seconds, someone in the United States needs blood, and a single accident victim may require as much as 100 pints of blood. And whereas blood donations are needed more than ever after large-scale emergencies, especially since they cannot be manufactured and can only come from generous donors. And whereas an estimated 38% of the U.S. population is eligible to donate blood at any given time, but less than 10% of the eligible population donates each year. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims January as Blood Donor Month to increase public understanding of the importance of blood donation and urges community members to donate toward this life-saving cause. Adopted this 14th day of January 2020, signed by your Board of Health. Yes. I always do that. Dang nabbit.
Very good. Thank you.
Oh, I was getting the middle of that. So it's like a pattern.
Smile. One more. Thank you. Thank you. Thank you very much. Thank you. Thank you. See you in here.
Okay, great. Moving to item 3, it's the opportunity for the public to address the Board of Health. I do not have any names in my hand, and looks like we don't. Anyone wanted to address the Board of Health? Okay. Then we move to item 4, which is the Health Officer's Report, and we're going to turn for this item this month to Director Slaughter.
Thank you so much. As you know, we are currently recruiting for a health officer, but we do have 4 interim health officers that have been supporting the work of our department, and that includes Dr. Alan Melnick from Clark County, who has been supporting us with environmental health matters, Dr. Kathy Lofi, she is the Washington State Department of Health health officer, and she has been supporting us with communicable disease matters. And Dr. Narita Massa from Seattle-King County is substituting for Dr. Chris Spitters to support us with tuberculosis cases. And then Dr. Daniel Stein from Mason County has been supporting us with vital records and other administrative matters. So on behalf of these health officers, I'll just share with you a couple updates. We've had 2 communicable disease updates that have been shared with providers in the community that I'll just briefly cover with you and our viewing public. One is regarding influenza. So the Thurston Lewis Mason Infection Control Network has determined that influenza infections are increasing and widespread in our communities based upon surveillance data. As of 12/28/2019, There have been 19 confirmed influenza deaths and 10 influenza-like illness outbreaks reported in long-term care facilities in Washington State. At the time of this report, Thurston County had 1 influenza death in an elderly individual over age 65, which is a high-risk population. Visits for influenza-like illness to influenza-like illness surveillance network providers have exceeded the baseline in Washington State, and we're continuing to see that grow, particularly with influenza type B, the Victoria virus. It is not too late to get a vaccine, so we highly encourage those that have not had the flu vaccine to continue to do so. And the actions requested of providers have been to require masking of unvaccinated staff in healthcare, long-term, and other congregate care facilities, to encourage influenza vaccination, and consider antiviral treatment for those experiencing symptoms or those at risk to prevent influenza. There has also been hepatitis A virus outbreaks, particularly among high-risk populations, including those unsheltered without housing and people who use injection drugs. Over the past month and a half, there have been 3 acute hepatitis A cases with ties to Thurston County that have been reported. And we have attempted to locate those individuals by multiple health jurisdictions, but have not been successful. So we're advising for people to get vaccinated against hepatitis A, and for healthcare providers who may see people with symptoms of hepatitis A to raise their index of suspicion when seeing certain symptoms. Our disease control and prevention staff are amazing, small and mighty team, and they do a lot of great work throughout the month, and they have investigated and followed up on 125 confirmed and suspected cases of various notifiable conditions. So we're really grateful for the work of that team and the support of our interim health officers. Any questions?
Questions?
Do you track shingles?
Yes.
Do we track shingles? I'm just wondering if there's an uptick on that and if people are getting vaccinated or not getting their vaccinations?
I do not have that specific information in the health officer report, but we're happy to follow up and get you those details.
Just curious. Thank you.
Okay, thank you. That moves us to item 5, which stays with Shelley for
Yes.
the director's report.
So I have just a few other department updates to share with you for my director's report. One is in environmental health. Washington State Department of Health tested drinking water at some local schools, including Meadows Elementary and other North Thurston schools, as part of a voluntary program authorized by the legislature in 2017 to reduce lead exposure to youth. On December 17th, the Department of Health released test results that found some water samples at Meadows Elementary exceeded the public health action level. The school district has taken appropriate measures and worked with Department of Health to mitigate these concerns, and information has been sent out to healthcare providers as well as families, advising them on actions to take to prevent lead exposure to kids. In addition, our Thurston shellfish growing areas on-site sewer pollution prevention proposal, we're happy to share that will be recommended for funding by the Puget Sound National Estuary Program. This was a program that was instituted by Congressman Denny Heck. This will provide $300,000 over 2 years to prevent fecal coliform contamination of important shellfish growing areas by ensuring that all on-site sewage systems are functioning properly. Our focus areas for this will be growing areas in Eld and Totten inlets, which have threatened or concerned marine monitoring stations, and areas proposed for shellfish harvest in Bud Inlet. And this project will continue efforts started in the Eld watershed that encourages proper septic systems. In other news, you will be hearing shortly a presentation by Keely Marino, our homeless response coordinator, who will be discussing the point in time count. And I also just wanted to say that our staff across multiple divisions have been working together to respond to public health concerns regarding encampments, including unauthorized burning at certain encampments, and have worked with ORCA, the Olympic Regional Clean Air Association, the City of Olympia, as well as our program and divisional staff to work together. And Thurston County has allocated $17,000 to help to mitigate some of these concerns at the campsite, to help increase the air quality and mitigate the public health concerns. We're also really happy in our treatment sales tax program, thanks to support from the Board of County Commissioners, to be able to provide mental health first aid training for multiple county employees. And this training will be offered 3 times in early 2020 at our Lily Road location. And we're really happy to be able to have the opportunity to bring that really important program, because many of us serve people that have behavioral health issues, and mental health first aid training helps us provide an informed and compassionate response to that. We also have a contract for parenting education for criminal justice involved individuals with substance use disorders, and we're really happy to be able to have that opportunity through criminal justice treatment account funds. And last but not least, we've also engaged in a contract with Washington State Poison Control to provide our after-hours answering service. And so just wanted to share with members of the public who need to report notifiable conditions or have after-hours concerns that they can continue to reach public health staff and support 24/7, 365 days a year, calling either our normal business number at Thurston County Public Health, which you can find on our website, or calling 911, and they will provide the appropriate dispatch so people can get immediate assistance. So we're always working hard, standing by to ensure that our community is safe and healthy. Any questions?
Questions for Shelley?
That 300,000 that you talked about that we're going to get a grant for over the next couple of years, and that's coming from some of the money Denny Heck had earmarked for Puget Sound cleanup, is that what it is?
Yes, that's correct, sir.
Have we got that completely earmarked? I mean, my concern is that up off of Johnson Point, Pleasant Forest, or that area up in there, where we have concerns about contamination and maybe Bottom Creek or one of the creeks. I'm just wondering, are we going to try to earmark something there to kind of get to the bottom of that? And if so, might we be able to go back for additional funding if we do find sources of pollution?
I don't have the answer to that specific question on what the grant and funding requirements are. Our Environmental Health Division Director is in the audience, Art Starry. Art, if you have any additional comments to add, could you please come to the podium and answer Commissioner Edwards' question?
Good afternoon. I'm Art Starry, the Environmental Health Division Director. So the grant that Shelley talked about, it's something that's new that's coming, that as she said, it's for pollution identification and correction, and it's focusing on the shellfish harvesting areas that she described. In response to Commissioner Edwards' question, we actually do have some additional funds that we're receiving to work in that particular neighborhood, and that includes making sure that we can identify the source of pollution and working with the community to actually develop a plan for correcting any problems that we find, including possible design and engineering work to try to design repairs for on-site sewage systems. So that, fortunately, we were able to get some money that, I think it was at a Board of County Commissioners meeting, you might have authorized that already. So we do have some funding to help work on that particular area, because it has been ongoing for a while, and it just takes time to get through the process, but we are actively working on that one.
Is there any chance I could take liberty of asking my seatmates, could we get a follow-up possibly on that particular activity up there, you know, within a month or so? I think it's a crucial.
Regarding
important-
Johnson Point?
Yes.
Hey, I would agree with that, yes.
No one
Yeah.
commissioner can make that.
Yeah, that's fine. Sounds good. I'll work
Okay,
with
is
Shelley
that,
on agenda item for
And
the
we have a
next-
briefing that's tentatively scheduled for you in February, where we're having a 2-hour discussion about septic systems and things like that. So we can include that in that
Oh,
discussion.
okay.
Hopefully, we can get it all done in 2 hours.
Don't leave, Art.
Oh, no!
I have a question that relates to you.
My question is for the director.
Okay, so let me jump in.
Okay.
And my question was about this new program that's focused on Eldon Totten Inlet. So that's separate money than what we're doing in Henderson Inlet? I mean, it's not diverting money, it's something.
We're not
new-
diverting money from Henderson and Nisqually for that. That funding is the ordinances that have been adopted by the board are very specific as far as what the uses of those funds are for, and they're for a specific geographic area. The work that we're doing that'll be on the Cooper Point, Eld, and Totten and Bud Inlet side, that's a special grant funding. It's not, we don't mix and match those funds at all. We're very careful about that. And Marcia, who's in the audience here, can attest to that.
Well, it wasn't so much that I was worried about, I was just trying
Yeah.
to, how excited should I be that this is a new sort of, additional beefing up of our efforts to try to.
I mean, I'm really pleased with it because it's allowing us to evaluate some different methods for how we can go about trying to get septic system owners to encourage them to monitor and maintain their systems. And so we're trying some different methods there to see how successful we should be. So we're really pleased with this, and I don't want to get too far afield, but it does take quite a bit of time to actually get things in the system in order to get this funding. And so we feel fortunate that we've been able to make our case and be able to get this funding. It's highly competitive. There were many millions of dollars worth of proposals that weren't accepted, and we feel fortunate that we were able to get something.
Are we flipping back to Henderson? Do we still have closures, shellfish closures there right now?
There's some limited closures. There's down at the southern end of the inlet, that's always closed because of the impacts of Woodland Creek. There have been some recent seasonal closures just because of the heavy rainfall. I believe that they will remain in place for a couple more days, but that's just because of the really heavy rainfall events that we've had over the last couple of weeks.
So some of the closures from mid to late last year were cleared.
Yeah, so some of the ones are.
I hadn't heard about this in about 90 days. So I'm
Yeah,
just curious.
there's another area, which is the area that Commissioner Edwards is talking about that's ongoing. The very southern part of the inlet, there's ongoing closure. There was recently a closure just because of the heavy rainfall events. There's so much material being washed into the streams that Department of Health closed everything for typically 5 days after the heavy rainfall event. And there's one of those in place now for a couple more days.
Okay. Thank you.
Okay, thank you.
My question for Ms. Slaughter is regarding the mental health training that the county is going to be providing to employees.
Yes.
What's the length of that training, and is the agenda already set, and how many different training sessions, or do we know yet?
We have 3 different training sessions scheduled for 2020, and the agenda is set. We do have a specific curriculum that we are following. It is, I'm not sure how many hours of the training that it is. We did have one that took place in the end of 2019 that was very successful, very well attended. And again, part of this has been funded by your Thurston County Strategic Plan Initiative 2 funding that the board designated last year to increase and address mental health training needs in our community, starting with our own here in Thurston County.
So what's the focus of the training then?
The focus of the training is really on how to best support and respond to those with behavioral health needs and crisis, as well as how those providers or employees can best support themselves when they're encountering really challenging situations.
So it's de-escalation and
Yes.
in crisis mode? Okay,
Yes.
thank you.
Thank you.
Okay, that concludes item 5. Department items under subsection 6 starts with a presentation from Keely Marino, on homeless presentation point in time count. Coming very shortly.
Very shortly. Good afternoon. It is a pleasure for me to present to you some of the efforts that we've made for the 2020 point-in-time census of homeless individuals living in our county. As you know, 2016 and 2017, Thurston County contracted, or you may or may not know, contracted with a private consultant to operate and implement the point-in-time census. And then for 2018 and 2019, we contracted with the City of Olympia to perform the point-in-time census. This is the first year in many years Thurston County has taken it back and operated it out of our office of the Housing and Homeless Prevention. I just want to do one shout out quickly to the staff at City of Olympia that worked so tirelessly on the PIT for so many years, who is retiring very shortly. And so a shout out to Anna Schlecht for all of her hard work that she's poured into the point-in-time count for numerous years. In 2018, I was a service provider and had the privilege of working with Faith Adicott as she was helping coordinating the effort with the City of Olympia. This year, we have the pleasure of not announcing, but acknowledging her great work as the contractor that we've hired to coordinate the point-in-time count. Under no circumstances could I have done this at all without Faith. In fact, 90% of the efforts that I will be talking about will be because of her great work. Faith has promised when she started an expanded and an efficient point-in-time count, and she has certainly already delivered. So what you have been provided is some of the questionnaires that we're using this year, but also this map. And so I'm just going to kind of take you through this map. This map is something that Faith created to demonstrate how much integration of our county and our local jurisdictions and providers that we, meaning Faith, has reached out to and engaged them in this process. So, and one name that's not in our team, so you see our team number 1 has my name, Faith's name, and Tom Webster, our program manager. Also, we have an intern this year who's been providing an awful lot of support. Her name is Francisca Hoffman, and she's working on her master's in public health. So I just want to make sure that we acknowledge her good work as well. So one of the things we're doing this year is a significant increase in camp outreach. And what we have done is worked with Just Housing Olympia to engage with 40 people who have lived experience, lived expertise, some of which still live in some of these encampments in our county, to be providing the service of having folks fill in surveys. We did some camp outreach in the past, also engaging folks with lived experience, yet they were not providing surveys. They were just engaging or doing what is known as a clicker count or a tent count. This year, they will be trained in how to do the survey, and will be going into the encampments and working with their peers to fill out that survey. So we're very encouraged that that unsheltered count is going to be much higher this year. We've also changed the forms to be a little bit more user-friendly. They're one page, and we've eliminated some of the, at times, confusing grid when survey takers are working with folks on the street and it's pouring down rain, and you're trying to figure out which box to mark. We've streamlined those. The design is Faith's. We've had them approved by Department of Commerce. We're good to go. We did add a few questions. One of the supplemental questions that we are asking, which has been asked in the past, but this year what's different is I arranged with the Department of Commerce for the question on LGBTQ status. So if a person who is in your household, or if an individual identifies as lesbian, gay, bisexual, and transgender, that be counted in the HMIS data. So we got that approved in the unsheltered count. We will be able to collect that data and then pull it from the Homeless Management Information System. So that's new. We also added a supplemental question on the form on question number 4. Question number 4 is, where was your last permanent address, including city, state, and zip? And then the supplemental sub-question A, if in Thurston, how long had you lived in Thurston County when you became homeless? So enumerating that length of time having lived in Thurston County, if that's where they identify having been from. We also included a youth-specific form, and that youth-specific form, after discussing with some of our youth providers, we took out the word household, because household isn't necessarily a way that a young person would identify themselves. They may identify themselves as being a part of a family. So we've streamlined the youth form to be addressing just an individual. If a youth does have a family, if they do identify it as being having a child or being in a household, we will use the longer form. But we just wanted to make it more youth-friendly and a swifter looking form for the young people. Likewise, we've added a supplemental questionnaire, which is also voluntary and also anonymous. This supplemental questionnaire for youth is based on some questions that came out of Chapin Hall. 2015, I believe, they ran the Voices of Youth Count, which was a federal effort to try to increase the number of youth being enumerated on the point-in-time census because it's traditionally an ongoing and undercount. So these questions that are on the supplemental form have been approved by our youth providers, but they're also coming from some research by Dr. Eric Rice. Dr. Eric Rice was the researcher who developed the Transitional Aged Youth Next Steps tool. So many of the questions on that supplemental form are evidence-based questions with the intent of being able to predict a young person's probability of becoming chronically homeless. So that data will be collected separate and will be going out to folks that are providing the survey for youth. And then we'll be collecting that and reporting on that to supplement the point-in-time census data. All right. We have increased youth count activities. Traditionally, we've just relied on CYS, which is in Community Youth Services, which is an excellent organization, is the coordinated entry youth option here in Thurston County. And yet, we tried to expand our youth reach this year. So we've engaged with Stonewall Youth. This is the first year that Stonewall Youth will be providing an event on the day of the census, and will also be able to conduct a 7-day count, which I will get to in a moment. And also Together, up in Tumwater, is putting together their own effort on how to count families and young people that they engage with in Tumwater and in Yelm. So that's a really exciting stretch for our youth and young adult providers. We are streamlining events this year. What we found, and I can attest to, having been a provider, is the events are really fun. They're kind of stressful for the providers that are putting them on, and they don't necessarily produce more surveys. I can say anecdotally that all the events that we had at Rosie's Place didn't necessarily create more surveys being opportunities for, well, it didn't make for more surveys. So this year we're streamlining it to, one, be just more efficient, and then to meet the needs of our providers. So up in the corner here, there is a little cluster. There's a CLO, Rochester, Nisqually, Safe Place. All of those, and there's two more, which is Capital Recovery Center, and then of course Stonewall Youth. All of those agencies are going to be providing a 7-day count. For instance, Roof in Rochester has had an event for many years that didn't necessarily result in more surveys. So this year, and they know who their people are. So this year, we're leaving surveys with the staff members at Roof, and throughout the subsequent week, starting at the 23rd and moving onward to the 31st, we will be able to collect those data, asking the question, where did you sleep on the night of the 22nd? This has been done before. It was done in 2015. I believe we did have a 7-day count across the board, but we are working with these particular agencies where we know they're going to get a much more accurate accounting of people who are experiencing homelessness if they can do it over a 7-day period. So that's really exciting. All right. We are engaging with community members that haven't traditionally been engaged with, that also represent under or overrepresented folks within our homeless system, but definitely undercounted over the years. So we've been reaching out to Cielo to hopefully do that 7-day count, and then also Nisqually. So what's exciting is that we got confirmation today that Nisqually will be helping to host several outreach efforts on their land for point-in-time count census volunteers, which is so exciting because there are a number of individuals that are homeless out there and not being counted. So we're super excited to be partnering with the tribe to make sure that we're counting folks out there. We've added 2 additional 2-hour trauma-informed care trainings this year. That has never been offered before. I'm actually providing that training along with Meg Martin from Interfaith Works. We had our first training on Monday. It went very well, and we're training again at the Community Care Center on Thursday from 6 to 8 p.m. for community members and point-in-time volunteers. all of our point-in-time count trainings that are being trained by Faith Adicott include trauma-informed care and trauma-informed response as a pretty pivotal part of that training, which I don't know the last time it's been done in that way, but we really tried to focus the approach. How do you approach people on the street while doing the survey, not just how to fill out the survey. So that's exciting. Every jurisdiction in our county has their own count, pretty much. So Yelm has just run with it. They've got a lunch, they've got outreach plans, they just owned it. They just took it and ran with it. Likewise, Lacey has planned a meal for families in the evening and has their own outreach efforts going on. And then City of Tumwater this year, they're arranging for outreach efforts that the staff members of City of Tumwater will primarily be engaging in those outreach efforts, but also with some of their local volunteers. And then, of course, Together being part of Tumwater. City of Olympia being our largest concentration of folks, visible folks experiencing homelessness, have a number of activities which you can see at the bottom left side of this diagram here. A lot of coordination with the City of Olympia to make sure that we are engaging their staff, their expertise, their people as to the best of our ability. And then we will also be doing kind of a clicker count of RVs and cars for the first time. This is going to be another part of the supplemental data that we'll be collecting. And we have also some of the incentives that we're bringing with us. So if there is a person who's going to fill out a survey during an outreach or at an event, they will get in return a really neat first aid kit, survival kit that many jurisdictions have matched funds from the county to ensure that their jurisdiction has enough for their people to distribute per survey. So it's kind of a one-for-one incentive for filling out a survey. We also will have survival gear available for folks, hand warmers, socks, hats, toenail clippers. All of these items were identified by folks with lived experience when Faith engaged with the mitigation site participants downtown and got a real sense of what is it that people really need. And so we really tried to tailor the incentives to be things that people actually need. The activities we're having haircuts at Rosie's Place and the Community Care Center, pet care at Union Gospel Mission. Bob's Burgers is providing burgers at Rosie's Place again, which is great. We're going to have coffee, food, and snacks at 3 camp locations that the City of Olympia will be hosting. Senior Services is having its own event. They'll be having a meal for the elders, but then providing snacks and coffee for elders and families throughout the day at the Olympia Center. And then we're supporting Family Support Center. They're not doing an event this year because, again, it didn't generate many extra surveys. How they get their data is by calling their folks on the phone and doing a huge outreach effort over the phone. So we're providing them with lunch while their volunteers are working to connect with all of their participants to get surveys filled out. So that's an exhaustive look at what we're doing this year. Those are all very big changes, and we're all very excited. And we need volunteers. So people can still volunteer if they reach out to PIT Census Team at co.thurston.wa.us.
PIT Census Team.
PIT Census Team.
Questions for Keely?
I don't know if I have any questions, but thank you for your enthusiasm because I'm sure it's infectious, so thank you.
Oh, yeah, no problem.
I do. And
Okay.
We'll start from the most recent and work our way back to the beginning.
Perfect.
Last year, Big Tom's delivered a bunch of lunches out to Rosie's Place.
Yes.
And a lot of those kids had never had an Egan's or a Big Tom burger before.
Yep.
And they were just a gaga. I mean,
Yep.
it was great. I don't know if they're doing it this year or not.
They are. I misspoke. It is Big Tom's that's providing the burgers. I'm still back
I
in the
tell you that-
70s in Idaho, and Bob's Burgers is what
God
pops into
love
my
them for
mind.
doing that. That is so cool they're doing that.
Yeah, it's
Kids
really
have never
cool.
had their tots, and oh my goodness.
Yeah.
Then I'm looking at the front of this, the City of Olympia.
Yeah.
What is charging station?
Oh, good question. That's also a new element to the count this year. We've reached out to First Christian Church and Ann Larson. So Ann Larson runs the Crisis Response Unit and the Familiar Faces program at City of Olympia. And she suggested, wouldn't that be great if we had a charging station? So if people wanted to charge their phones, they could go somewhere quiet.
Oh, it's actually a charging station.
Yeah.
Okay.
So for 4 hours at First Christian Church, there will be snacks and coffee and some volunteers there to help folks fill out surveys, and also they get a chance to quietly charge their phones.
Is that a nonprofit or a group of people? What is it? All right.
Yeah.
And finally, you started with the county's doing point in time this time, but you said we're taking it back from Olympia. Were they giving it up? I don't want people to get the misconception
Right.
that we're taking it back.
Well, that sounded very aggressive and assertive of me, but actually it was placed on my lap very lovingly by the city of Olympia.
Thank you. And we accepted it lovingly.
We
too.
did. I said, thank you for this. I
Yeah, thank
never
you.
wanted anything but more than this.
Thank you very little. Okay. Thank you very much, Keely.
All right.
So Keely, earlier when you said that you're excited that there's going to be a high count, what I think what you mean is that the count's going to be more accurate.
Yes.
Obviously. And on this is really pretty cool, actually, and well done. And logical. It's like so many times you see a graph like this, and it seems like somebody just had a lot of fun, but it's not necessarily very illustrative,
Yeah.
like illuminating about, but this actually is based on what we're doing, so this is cool. What is West Olympia Rovers?
So that's a team headed up by Kerry Retland, the home fund manager at the city of Olympia. He's done it several years in a row. And so they rove up on the west side to specific camps. And then also there's certain locations where people are known to congregate who are experiencing homelessness. And he works together with Habitat for Humanity. So they have a whole kind of thing going on that's just for the west side.
Cool, excellent. The other specific question I had for you is the question about LGBTQ identity. On the survey, it says, does any person in your family group identify? And then that's it. And then on your youth supplemental, you ask a very specific question about the individual.
Yes.
So I guess I'm wondering why would you leave it at, why would you leave the general question in the case of adults without asking the more specific question? That seemed like it would be more valuable.
That's a good question. It is not a data point that is recorded typically by point in time count homeless management information system data points. So it's been asked for supplemental data, but it hasn't been recorded with the Department of Commerce. So, and with the spirit of keeping the form as brief as possible, because some of these questions are invasive. There will be census givers that are asking people, have you experienced job loss, eviction, mental illness, alcohol, substance use? So in the spirit of just keeping it brief. With the youth, as most people hopefully know, now you do, 20 to 40% of all young people experiencing homelessness are LGBTQ. So there's always been a heavy emphasis on calling out the LGBTQ identity with youth. I'm on a personal mission to make sure that that continues on for HMIS data entry ongoing, because in our program entry for our system, once you hit 25, no one asks that question anymore. At least it doesn't get recorded in HMIS. And so it's kind of a slow step towards making it a more common and robust question that will be in every single census.
And for folks who are listening to this and may not be as familiar as we are with this, can you explain HMIS and
Yes.
why it's important?
For sure. The Homeless Management Information System is a national database that is required for all people receiving HUD funding, be it from the federal government, from the state, from Commerce, to enter into a very secure database, all people experiencing homelessness as they enter into a program. So we use it, all of the folks that we contract with are required to use the Homeless Management Information System. There are some folks that do provide homeless services that do not receive any governmental funding, and they don't have to participate in it, but we do. And that data is what determines our level of funding from the federal and from state government.
And we use that information is used to help folks, not
Yes.
for any other
Right,
purpose,
absolutely.
but more
It's 100%
objectionable purpose.
secure. You have to be very trained. You have to go through all this rigorous, like 7 different papers that you sign to make sure that everyone knows that this is protected health information.
Thank you, Keely.
Yep.
Oh,
Maybe just
another one.
One quick one.
Yeah.
On your supplemental youth survey, under question number 4, what is welfare cash assistance? What does that consist of?
I don't have it in there.
The
That would
question
be,
is,
yeah,
do you
please.
have it in front? The
I don't.
full question is, do you currently receive any public or government benefits such as Medicaid, food stamps, SSI, or welfare cash assistance?
That could be an antiquated question that we took out of the Chapin Hall Voices of Youth count, but I would assume it'd be any kind of subsidy that they're getting from the government, be it cash, SNAP benefits, et cetera. So,
Do they give out cash yet? I guess that's my concern.
no, I don't think they don't give out cash, so I think that's an antiquated question.
Could,
TANF does, through the food stamp program.
Yeah.
Come forward to the
Yeah.
podium for
Through the food stamp program, they do allow some limited cash benefits in conjunction with that, particularly to people who are living in family groups. That question is, I think, a little bit antiquated, and we did pull it straight from the data of what's been approved and used for other groups. Also, colloquially, if we're out talking to folks and you say welfare or cash assistance, people will still be able to identify that. It's kind of a catchphrase. It should catch most of people who are getting benefits. And people can, if we'd like them to, we can ask them to say, follow up on that, like what specifically are you receiving from the government?
Real quick, Faith, can you
Yeah.
identify yourself?
Hi,
Since
I'm
you're-
Faith Adicott. I am the contracted point-in-time coordinator for this year.
I guess I would like to know for my constituents that pay attention to this stuff, what that is, what it consists of. Just as a critique of it, I guess, a certificate for a hamburger at, McDonald's or whatever. I think a lot of people feel there's less abuse with that than there is with cash. So I'd like to have that answer if I could get it at some point. What's eligible, the audit procedure, some different things like that.
I'd be glad to.
Thank you.
Anything else for Keely?
That's it.
Thank you.
Thank you.
Okay, our next item is 7, 2020 Social Services and Public Health Legislative Priorities. Art Starry from Public Health, Environmental Health Division.
That's still Art Starry, right?
So thank you again. I'm Art Starry with the Environmental Health Division, and I'm here speaking on behalf of just the whole department. And one of the things I get to do is try to track legislation and be involved with some of the state budget process, at least as far as tracking that. And I work in conjunction with the Washington State Association of Local Public Health Officials, where I'm the legislative chair, I guess. My co-chair left me. So one of the things that goes on is now that the legislature's in session and its supplemental budgets are being proposed is that WSALFO, which is that public health group, which is an affiliate of the Association of Counties, tries to pay attention to all those things that are going on. And we've established a set of priorities, working in conjunction with the Association of Counties and the and ACHS, which is, I could never remember that particular thing, which is the Association of County Human Services, to identify priorities and things that we would like to see the legislature accomplish over the course of the year, of the session, as well as look at budget things. And so again, we both look at bills, we've established priorities, which I'll talk about here briefly, and then we also look at the budgets, because really, at the end of the day, you can pass bills, you can do stuff, but if someone really really likes you, then they'll put you in their budget and give you some money, or they'll provide resources for stuff. So that really is really important to us. When you look at the different things that I've provided for you, when you look at what the priorities of the different organizations are, you're going to see that housing and homelessness, which is it's appropriate that Keely was up here beforehand, that's a big thing. Trying to figure out ways to both respond to the homelessness crisis and to provide additional funding for housing. You'll see everything from information that's in the governor's budget to try to supplement or provide additional resources to the counties, to provide additional mechanisms for the counties and the different government organizations to be able to fund housing, to dealing with things like, how maybe the governor this year has actually put in money for helping to clean up homeless encampments and to provide resources to the state for providing cleanup and cleanup and I guess infrastructure for some of the things on state right-of-ways, for instance, like Department of Transportation. So there's kind of the whole realm of things is being considered this year, or looked at this year. There's behavioral health and the opioid crisis. Of course, that's a big thing. There's lots of concerns, and as Keely mentioned, there's a relationship between a lot of behavioral health issues as well as the homelessness. And so there's trying to be able to provide adequate facilities and services and funding. And in looking at the materials that have been provided, there seems to be a need to try to provide resources for folks who aren't really Medicaid eligible. There's kind of a gap there, I think, as far as looking at what services are provided and whether you're eligible for Medicaid and whether you qualify for some of the services. As far as public health is concerned, if you look at our agenda, the things that we're most concerned about, or one of the things we're most concerned about, is providing funding for something called foundational public health services. So last session, you might recall that you, as the board, were asked to support a letter that went to the legislature asking for to support legislation that identified what foundational public health services are, and those are the services that should be provided to every person in the state of Washington, and identified some key things there. The legislature also provided some funding to help local health jurisdictions meet those foundational public health services. It was kind of a down payment. Not nearly enough, but they were, nonetheless, the legislature provided 20, or at least authorized $22 million in funding that would be distributed to the different state local health jurisdictions. So that was the good news. The bad news was that they tied part of that to a vapor tax, in other words, for vapor products. And so the revenue wasn't accurately estimated, so it's underfunded. And then on top of that, as you know, the State Board of Health basically banned certain types of vapor products, and so that's decreased revenue even more. So one of the things that WSALFO and actually the Association of Counties and others are hoping is that the legislature will fill the gap or make up the difference between the $22 million that was authorized and the actual amount that's likely to come about from the current vapor tax and the other money that was put into the state budget. So that's a big thing for us. And speaking of that, vapor and vaping products, that's another priority for public health this year. The action that was taken by the State Board of Health to ban certain types of flavored products, that was just an interim measure. And so the legislature needs to take up some sort of action to decide what the fate of that is. Will there continue to be restrictions on flavored products, or will that totally lapse when the State Board of Health's emergency order lapses here in a little bit? Another little fun thing that's neat for me is that there's we're hoping that there'll be restore some funding for our local Group B, or small community water system program that the legislature provided a few years ago. That funding lapsed. We're told that it was an oversight, that it wasn't put back into the budget, so we're hoping that that'll be retained, but we don't know. So that's something that WSALFO will be working on. And other things that you'll be seeing that kind of fall into this stuff are dealing with things like climate change and trying to deal with the effects of climate change, or trying to deal with sustainable resources, things that relate to that. There's a lot of different legislation that's being proposed, and that's something that'll be coming forward that we'll be likely seeing. So that's, in a nutshell, the different things that you'll see in the materials that I provided. One of the things, as I mentioned, is that we often get asked to provide information or provide testimony on these legislative issues. And in order to do that, I guess there's two classes of things that come about. There'll be things where we'll be contacted by a state department or legislative staff for just objective information like facts, like how many of these did you do, what's your budget for that, and those are the sorts of responses we try to give as quickly as we can within the resources that we have, and we just try to do that. And I think because we're here in Olympia, we get a lot of those calls because they kind of know where we are and they know where we work. The other types of things that when we're being asked to provide information or education, or to maybe give the county's position on a particular bill or a particular topic or budget, in that case, we need to make sure that if we're going to do anything like that, that we get the authorization of you as the county commission and the county manager, Ramiro Chavez. So what will happen on something like that is if we receive that request, our staff would then send a note to Ramiro and say, here's what's going on, here's what we're being asked to do, here's the position we think we should take, and then make sure that we're authorized before we do that, because we're not allowed to do lobbying. We need to make sure that we do things that are authorized by the board. So that's something we work on really carefully to make sure we don't get out of bounds there. The bill process has already started. In the last few days, I think I've scanned about 300 different bills that have been filed. Those are ones that are new bills for this session. All the bills that were filed last session, they carry over, so they're all alive and active and potentially can be acted on. I've already seen things dealing with stuff like lemonade stands and foam packaging. Someone wants to make sure that the health departments don't require permits for lemonade stands. Apparently there's some jurisdiction that did that, so the legislature's going to be involved. Things like micro enterprise home kitchens, like whether or not someone might be able to sell certain food products from their home without having to go through the normal food establishment process. So there's lots of things out there, and I could go on and on and on. I do want to say one thing, though, that's kind of the big cloud on the horizon that might influence all of this is whether or not, or how the legislature chooses to deal with Initiative 976, which is the car tab initiative that passed. And so while that the action on that has been temporarily suspended by courts. The legislature has to decide, okay, what do we do? Do we honor the intent of that initiative? Do we try to provide funding for transportation issues? Aside from that, who knows what they're going to do, and we don't know quite how that's going to impact the state budget overall, because of course, as you know, that represents hundreds of millions of dollars worth of funding that if the initiative goes into effect, or if the legislature honors that, they're going to have to come up with alternative funding for transportation purposes. So that's kind of the big cloud on the horizon. We don't know if it's going to come in storm or if it's going to break up. Only time will tell. So that, and is really quickly, my legislative stuff, I again, glanced over it really quickly because I know it's getting late, and plus, the solid waste folks are here, and they're really the stars of this afternoon, so I want to make sure that they get their fair time.
Questions for Art?
No, I'm good, thank you.
No, thank you very much, Art.
I have a 12-year-old who would love to testify about the lemonade stands if you need somebody.
Okay, well, the way the bill's proposed is that until he's 18, or he or she is 18, they'll be able to have a licensed, be able to have their permitted, unpermitted.
Well, you can't put a stand up with an RUE.
Yeah. We'll see how that goes.
All right, thank you.
Okay, thank you.
All right. That takes us to our last major agenda item, which is solid waste compliance successes. We have Patrick Soderberg here and Mark Koster. Thank you, gentlemen.
I'd like to thank the board and the Board of Health members to allow us to talk about our solid waste program. I know that your office received a lot of complaints this year in 2019, not just about solid waste, but I wanted to summarize some of the successes that we were able to work with our residents with to get some compliance. And although our solid waste program does respond to solid waste complaints, we also regulate solid waste handling facilities. But we're going to talk today about mostly just the complaints that we responded to and some of the key ones that we got cleaned up. Our solid waste program goals is to protect public health. And by proper management of solid waste, you reduce the potential for the spread of disease by rodents and other disease-transmitting vectors, flies and such. We also protect our drinking water and our air by not having garbage and hazardous material disposed of on the land. We work with the Olympic Region Air Control Authority to work with people who are burning garbage and to address that and try to get that to stop, and how to get the people to manage their solid waste properly. And we also want to just reduce any sort of exposures to any toxic material that either comes about through the degradation of solid waste or even the inclusion of hazardous material in solid waste piles. The process that we use for our can you go to the next slide? For solid waste processes, we start by educating and providing on-site technical assistance, either to a solid waste handling facility or through a complaint that somebody seems to be mismanaging some of their waste products. We coordinate with our local agencies and local departments here in Thurston County so that we have the least amount of impact to our residents by trying to get all proper agency and staff there together at one time to deliver a clear message and to provide assistance. We permit those solid waste handling facilities that require it, and then we follow up by regulating them to ensure that they follow their permit requirements. And then we do enforcement on solid waste facilities or solid waste complaints that don't cooperatively manage their waste. So we get solid waste complaints through referrals from the outside agencies, county departments, coordinating agencies. We also have a hotline number, which is 360-867-2664, and that goes to all of our hazardous and solid waste inspectors. There are 4 of us, although this work for the solid waste enforcement really is just about 1.5 FTEs. So we split our work up with the solid and hazardous waste group, but primarily the complaints that we respond to is just about a person and a half doing all the work. We also have a website where the best way to find our website and to file a complaint on our website is to go to a search engine on the internet and type in Thurston County solid waste complaint, and then if you can go to the next slide, please. This is the home page that you'll land on if you type in that search engine and go to the top one. And you'll see in the upper right corner, I have highlighted the hot topics area, and that is where you find the complaint form. And if you click on that, if you can go to the next one, you'll get to that form. And that's how you would file a complaint. And then once you file that complaint, you're going to meet Mark Coster.
Any question?
Yes.
Is there a spot to file an attaboy or a compliment, or just complaints?
No, you just get to call them up and respond after you meet them. And so there's no area, I mean, this is just for complaints. I mean, I suppose you could fill it out and say, thank you very much, and not put in a solid waste complaint. But no, typically what happens is once we get out there, we are working person to person. And so we directly work with the person who complains as well as the person who was complained about. So typically there's a fair amount of interaction with the inspector themselves, and usually they will let them know if they've done a good job or let me know. I get compliments about staff actually quite frequently.
I'd like to tell us how we're doing.
Right.
Rather than complaint.
So Mark's going to go through some of our bigger complaints and some of the numbers that we've generated from these cleanups.
Thank you for letting me jump in.
Sure. All right, Mark, thank you.
Good afternoon, members of the Board of Health. My name is Mark Coster. I work for Thurston County Public Health and Social Services. Thanks for the chance to speak with you today. So picking up where Patrick left off, we arrive at a property where we've received concerns, and we're often faced with barriers or challenges. Sometimes they are physical in the sense of a gate or a fence or nobody we can speak with because they're not home, they don't live there, or they're deceased. In other cases, the barriers are legal or logistical, meaning that the property is in some sort of part of the foreclosure spectrum, and there is maybe not a responsible owner at that point, or there are renters there, and so we're faced with balancing landlord-tenant concerns with trying to effectively do the work that we need to. So we're happy to talk a little bit more about some of the successes and the highlights that we've had. It was a really good year when we start adding up all the numbers, despite all the calls that we continue to get and some of those that you may receive or your staff may receive. We have felt very successful, and so the 5 properties that we're going to be looking at represent a fairly substantial chunk of that success that we've had. So if we move along, we're just identifying the properties by 1, 2, 3, not by names or locations other than kind of general. So we tried to select those that represented a good cross-section of different types of properties that we deal with, some rural versus some that are more within the urban area of the county or closer to population centers, some that are undeveloped versus not developed, to highlight just the whole spectrum of what we're dealing with. So this first one, looking back, we first initially started with this property in different cycles back to 2015. There was success with the property owners over the years getting things improved, but because there were renters, tenants there, they never really seemed to stick. So fast forward to the end of October of this year, when the property owner representative was finally able to do the full legal eviction of everybody who was supposed to be at the property and also those people that were not supposed to be there. And they finally resumed control of the property to start effecting the cleanup that we were asking them to do. They were also motivated because they have future plans for the property, and our violation status was getting in the way, creating its own barrier for them to do that. So they were encouraged to keep moving forward, and we had some good communication with them. So you'll see some pictures, tried to provide some before and after. Moving along, the cleanup is as done as it's going to be, and hopefully it won't be getting any worse in the meantime, but that is always the concern. And so there's restricted access to the property. They're trying to keep a greater eye on it, and they've engaged with community members around there to have them also be mindful of that and have some more conversation if they observe things that might be leading it down a bad pathway. So looking at some of the totals for that one, I think we came up with something like 63 tons of material that we've gotten receipts for or documentation. So on all the cleanup work that we're getting people to do, we're asking for receipts, whether they are invoices or statements from solid waste hauling companies or from them just taking it to the transfer stations. So we're trying to total that all that up using good hard numbers. In some cases, we do have to estimate. So many of the numbers that we provide are kind of a conglomeration of known real facts and then some professional estimates. So moving on to the next one, property number 2. This is down in southwest part of the county. This is a property that was kind of in the deceased owner foreclosure status for quite a long time and generated a lot of interest because it's a neighborhood or close to other properties and created a lot of concern with rodent vectors and just unsafe conditions because of the foreclosure process. Moving along to the next slide. It became unoccupied, but there were still barriers from the bank and law firms being able to move it along to an actual property owner who had the authority to clean it up. But we continued to engage all the parties that we could find who would listen and those who would not, to get to a point where, fast forward again to September of 2019, where it's finally conveyed to a third-party contractor who is working on rehabilitating the property to turn it around and sell it. And in doing so, they're cleaning up, removing all that debris that had accumulated over the period of time that we were involved with it. So coming up with a kind of final number for that one in the realm of 72 tons. That includes regular garbage, metals, car bodies, etc. Moving on to property number 3. This is property south of Tumwater. Undeveloped, had been logged, forested and logged at one point, and had started to accumulate a bunch of things and occupants on the property. And so we need to engage with the property ownership, an LLC company. So letters went out and we actually got a response and found a contact down in San Diego who came up here and again, went through the legal foreclosure or the legal eviction process for folks that were on there, provided us the access to get out there, got a contractor on board to remove materials, remove car bodies. There was coordination at this time as well with the sheriff's office to go out there, provide safety for us. They have interactions with folks. And so moving along again to September of 2019, that was kind of a good month for us. We had a bunch of success, and onto that last slide, we're somewhere in the realm of 194,200 pounds of solid waste, a lot of vehicle parts, chunks, trailer frames. You could think about it, it was probably out there and got removed. Moving on to property number 4. This was another larger parcel, but rural. Again, rural, and also, but had a residential structure on it as well as a business. So the family that had this property, they were kind of collectors and accumulators related to their business, which auto repair, vehicle repair. So there was a bunch of stuff on there. They were unable to take care of it anymore, and so it wound up in the hands of a contractor who's starting to do a lot more work in this area, again, rehabilitating houses. So once we found that good contact, we were able to help navigate them through cleanup processes and provide them with information they needed in order to find the best avenues for getting rid of materials and where things could go. So over the course of December of 2018 through the middle of the summer, we're somewhere in the realm of 161,700 pounds of material, give or take. Moving on, that kind of wraps up number 4 for us. And then the last property, closer into town, north of Lacey, up in the Hawks Prairie area, in a smaller residential setting. Had been a property that we have been involved with numerous times over the last several years. Wasn't nearly on the same scale as some of these other ones, but since a lot of people lived close to it, quite a bit more visible, and so we would get the same amount of calls about that sort of thing. So in that sense, we tried to engage the people who were living there. There were certainly family challenges with that one. We ended up going through the process of issuance of civil penalties, but at that point, a different family member was able to find our correspondence and actively engage with us. We didn't have to collect on any of those penalties, and they were able to clean things up and keep it clean. So we're happy moving into 2020 that it's definitely on the right path. So if we get to some of our totals for the year, about what we did, we're kind of in the realm of looking at about 129 new complaints, conducted close to 600 property inspections. That includes the new complaints and those that have carried over from prior years. 78 were able to get closed out. That's a combination of new ones and older ones. Again, like I said, we didn't collect any civil penalties, but we were able to use enough leverage of those to effectively gain some compliance or consider moving it further past those. I remembered 115 junk vehicles and 35 buses, trailers, and final numbers are close to 1.2 million pounds of solid waste that we're able to effectively leverage people to get disposed of. And when Patrick wanted to correlate that to something that might mean something to other folks that are listening, if you have somewhere in the realm of a 2,000 square foot house, you're filling that up
12
houses. Times. And so that's one way to think about that. And a lot of these numbers that we're putting together, those are totals of the ones that we've been able to complete to some degree and clean up, not the ones where we've had 500 pounds moved this month or 400 the next month. So there's ongoing properties that are making progress that are not totaled up in that number. So that's just kind of the all said and done number for those that have been taken care of. The last slide again shows how to reach us if there are questions, if the public has questions, concerns about something that's ongoing or something that's popping up in their community. And we realize that a lot of the selection of properties that we showed today don't maybe don't represent the most visible, but they're certainly visible to people that are living near them or driving past them every day. And so it's certainly important to those to highlight and share some success on. Do you have any questions?
Commissioner?
Did you ever get that mess cleaned up at Single Tree Estates?
No, that is not, that is a compliance process or kind of in the realm of abatement that the Community Planning and Economic Development Compliance Group has been working on in terms of a dangerous structure or however they're classifying that. Although there may be solid waste accumulated there, or it might just turn into a pile of solid waste by the time that something is done, when it potentially collapses in on itself. We're not actively pursuing that one in the same way that they are at this point.
Question?
Yeah, and if I were one of the folks that, when I look at the before and after pictures, my goodness, what a difference. And if it was in my neighborhood or I had to drive by and look at it, I'd be getting online and sending you an attaboy or an attaperson, a compliment. By the same token, if I was the owner of one of those properties and got in over my head and you came out and helped me out, I would be thankful too. You don't have a figure though, what it cost for that 1.2 million pounds of waste removal, and how do we get that back?
Well, yeah, I mean, you could correlate that into the value of what that is in terms of, you know, the cost of straight disposal at $119 per ton.
Per ton, okay.
But that does not figure in our time that we
Gas
need
and
to
all the other-
spend and going out there to
Right.
to do, you know, close to 600 compliance visits. So some happen a lot easier than others, and some do not.
And do we put a lien against the property? We get money back, we bill them? How do we get paid for that?
A lot of our work is derived by grant funding from the Department of Ecology and as well as from a portion of the tipping fees that we collect in the county. Patrick
Okay.
has shared with me that that 1.2 million pounds is roughly $72,000 worth of straight tipping fees that are you know being collected through a variety of either solid waste providers or them handling it directly themselves.
Wonderful.
Director Michelle Slaughter.
And Mark, could you just clarify a little further on the funding, that the impotence on some of the costs of disposal are on the property owners themselves and the county's not incurring the actual disposal costs of those?
Correct. We are not providing any funding to the property owners at this time. There have been mechanisms in the past, but that's in the past. So we're only you know using our time and our efforts to try to get them to the finish line. So it's all on the occupant, the renter, the property owner, whoever wants to be responsible, whoever we can hold responsible for getting things cleaned up.
No gift of public funds?
Correct.
Correct.
No.
Okay.
One other comment that I just
No.
that I just would like to share is with all of this work that they highlighted that they did in 2019, that doesn't even begin to capture everything that this amazing group does. This is a team of 4 people who are responsible for all of Thurston County, and they do amazing work. It's incredibly hard work when you're working on compliance, and this team approaches their philosophy is a partnership. They are very compassionate in their approach. They often become informal social workers as they're really looking at the complex issues that are leading to some of these solid and hazardous waste complaints. So I just really want to commend the amazing work of this group that they do every single day. It's very difficult, and they do a great job.
Thank you very much.
Thank you, Shelley.
Mark, my question was about the public health component of what you guys respond to, does that mean that we ever get involved in something inside of a municipality, or are we only handling the unincorporated county and the cities handle their own? How is that?
We certainly can. Our authority extends throughout the county. We do coordinate with compliance members and staff within the smaller jurisdictions, municipalities. When we get complaints that are within their jurisdiction, we'll pass that along to them with the offer of, if you need assistance, please let us know. But we, as the primary jurisdiction, we'd like them to kind of have the first crack at it, so to speak, and see what they can do. And we'll certainly be there to support and provide additional leverage if necessary. And we've done that in some instances, especially if their properties happen to be maybe on boundaries or close to others that they're actively involved with.
Very good. Thank you.
Thank you very much.
All right. So we're getting toward the end, and we're right to the end of the agenda where we report on Board of Health members' health-related activities. And I'll start with Commissioner Edwards, if he has any to report.
Biosolids. I made mention earlier in our board meeting, but there are some very serious consequences that are coming to light from application of biosolids that come from municipal sewage treatment plants. And I'll let it go at that. That's been my go to Hutch.
I don't have anything health-related other than I got informed our puppy got his shots.
The only thing for me to report is the opioid task force is an ongoing, we'll be meeting every other month at this point, and I attended that meeting, and we had a very interesting presentation from folks at the state regarding some new legislation about mental health diversion, trying to get everybody to understand the parameters of that. And so we're working with the prosecuting attorney, and Commissioner Hutchings and I both serve on the behavioral health organization. It's no longer called that, but we're very deeply involved in mental health issues from month to month in our role on that governing board as the BHO becomes the BHA and ASO. And if you have questions about that, reach out to us. It's pretty interesting stuff. So with that, we'll adjourn. Do I need a motion to adjourn?
Nope.
No, I'm just going to adjourn the Board of Health for today, 4:57. Thank you.
Thank you.
Very good, sir.